How can these bacteria, which are ubiquitous in environmental water and soil, pose a significant threat to human health around the world? Even though only a small proportion of non-tuberculous mycobacteria are considered pathogenic to humans, they pose a significant health risk in many countries. Let's start with the basics. Non-tuberculous mycobacteria are also known as atypical mycobacteria, or NTM for short. An NTM bacterium is an aerobic, non-spore-forming, rod-shaped bacterium with a waxy, relatively impermeable cell wall. This waxy surface gives the cell wall a number of special properties. The various NTM species differ greatly in terms of their virulence, growth rates, and sensitivity to temperature and antibiotics. The most frequent pathogens include M. avium and M. intracellular, which are grouped together as Mycobacterium avium complex, MAC, along with M. consacei, M. xenopi, and M. abscessus. MAC infections were the clinically most significant species to date, predominant across disease categories and localizations. It is important to note that NTM epidemiology is changing over time. This requires reevaluations of geographic differences. Climate change could play a role. A warmer, wetter climate means more areas where NTM can inhabit. In the United States, for instance, warmer, humid southern regions generally have more NTM isolates than colder, drier ones. NTM bacteria are ubiquitous in environmental water, soil, and dust. They have also been found in food, such as cheese, vacuum cleaners, cobwebs, liquids for metal processing, fish tanks, and foot baths. Let's focus on spots that are even more relevant, those linked to drinking water systems. These engineered habitats are ideal for NTM. They are also associated with healthcare settings, particularly with catheters, injection needles, and scalpels, as well as with dental units and endoscopy reprocessing processes. A healthcare facility's water system can be a great reservoir for NTMs. A U.S. study revealed that 61% of hospital water systems in 21 states were contaminated with mycobacteria. Contamination levels in hospitals were the highest compared to other buildings, including offices, hotels, and private residences. Other investigations of hospital water have also reported high mycobacterial concentrations. Which risk factors can promote NTM growth? Water stagnation and limited hot water temperatures may contribute to the formation of biofilms and create conditions conducive to mycobacterial growth. Biofilms provide a source of nutrition and protection for microorganisms. That is partly why it is so challenging to eradicate mycobacteria from water systems. Additionally, NTM are naturally resistant to common disinfectants, like chlorine, and to high water temperatures. These factors are crucial to the resilience of non-tuberculous mycobacteria in water systems. Other properties include hydrophobicity and resistance to desiccation and most antibiotics. Transmission of NTM to humans is almost entirely waterborne, occurring through the inhalation of contaminated aerosols and dust particles. It is essential to take special care in the hygienic reprocessing of medical equipment due to the spread via contaminated water. Endoscopy specifically poses an elevated risk, so the water used for rinsing must meet impeccable microbiological quality. Media reports and studies, particularly from the US, document quite a large number of cases in which children were infected with non-tuberculous mycobacteria following dental procedures. They have also gained significant attention due to an outbreak linked to heart operations. Contaminated devices caused life-threatening infections. The number of diseases caused by NTM has clearly and consistently increased over the past several years. Most NTMs rarely cause disease in humans as long as the immune system is working properly. However, they can cause serious infections in immunocompromised or elderly people, children, smokers, and people with low body weight. And it is evident that some of these can lead to disease in any individual, impacting both pulmonary and extrapulmonary sites. The most prevalent diseases include respiratory diseases, skin and soft tissue infections, and disseminated diseases. NTM lung infections are characterized by symptoms such as cough, shortness of breath, weight loss, and fatigue. Symptoms of extrapulmonary NTM infections depend on the site of infection and can include skin lesions, fever, weight loss, swollen lymph nodes, pain, and night sweats. The diagnosis of these infections is challenging. Precise microbiological identification and detection are difficult because little is known, and it takes time, especially for slow-growing NTMs. There is no standard therapy for NTM diseases, making drug therapy difficult and time-consuming. It depends on the species and its sensitivity to certain antibiotics. The treatment of NTM infection is complex and requires prolonged and multiple antibiotics. A reliable diagnosis is essential for treatment. Without treatment, NTM can lead to death. In Germany, for instance, patients with NTM lung diseases, NTM-LD, often face late diagnosis, a poor prognosis, premature treatment discontinuation, and high follow-up costs. NTM lung disease is linked to more sick days, doctor visits, hospital stays, and emergencies. Diagnosis is often late, and treatment options are limited. German health insurance data analysis revealed increased NTM lung disease mortality. The disease burden on patients, cost of illness, and increasing prevalence require optimizing the care of those with NTM lung disease. To provide appropriate care, the care concept must evolve. Many environmental types of non-tuberculous mycobacteria make prevention challenging, especially for lung disease patients. Upcoming studies aim to greatly improve knowledge on environmental NTM niches to understand ecological factors causing NTM lung disease. There's a critical need for surveillance of this emerging, non-notifiable infection. It supports clinical decision-making and shows NTM is not a single entity. A public health approach to NTM infections is important. Healthcare professionals need awareness through publications on NTM HAI risk factors and trigger clinical and microbiological vigilance through networks and registers. There's a need for comprehensive risk assessment for NTM in water supply systems. We applaud all efforts to better characterize NTM epidemiology. A multi-barrier system is essential to prevent infection until additional security measures are implemented due to constant developments. The core components to combat HAIs are well known. Hospitals must ensure that all the necessary elements are in place to provide a comprehensive strategy. Hand hygiene is essential. Surface disinfection and point-of-use water filters are two more pillars that are absolutely key to sustainable and effective infection prevention in the medical field. While you take control of hand hygiene and surface disinfection, we help you minimize the risks associated with water-bearing systems by providing water filter, point-of-use, or as inline filters.